Welcome to our video on everything you need to know about fatty liver disease. If you or someone you know has been diagnosed with this condition, you've come to the right place. Today, we will talk about what fatty liver disease is, how it develops, the risk factors, signs and symptoms, the diagnostic tests, how it impacts your overall health, treatment and management, as well as home management and prevention. We'll also answer the question, is fatty liver disease reversible? Let's dive right in and talk about what is fatty liver disease. Fatty liver disease is a complex medical condition characterized by excessive accumulation of fat in liver cells. This can potentially lead to serious liver damage and complications. There are two primary categories reflecting the underlying cause and the risk factors. The first is metabolic dysfunction-associated steatotic liver disease, MASLD, also known as non-alcoholic fatty liver disease, or NAFLD. This affects approximately 1/3 of adults in the United States. It usually develops in people who consume little to no alcohol but have other predisposing factors, which we will talk about in a little bit. The second one is alcoholic fatty liver disease, or AFLD, which stems from excessive alcohol consumption and impacts roughly 5% of the US population. How does fatty liver disease develop? The accumulation of fat occurs through multiple pathways. Fat can migrate from other body areas to the liver. The liver may increase its absorption of fat from the intestine, or it may lose its ability to process and eliminate fat effectively. This process is complex and often involves several parallel factors, including insulin resistance, oxidative stress, mitochondrial dysfunction, and changes in the gut microbiota. Risk factors. There are several factors that can predispose you to having this condition. For instance, it is strongly associated with various metabolic conditions like obesity, particularly if you have excess weight around the waist. Type 2 diabetes, elevated triglycerides, and high cholesterol levels. In addition, contributing factors also include rapid weight loss, certain medications, having sleep apnea, polycystic ovary syndrome, and thyroid dysfunction. Having metabolic syndrome significantly increases the risk of developing the condition as well. Metabolic syndrome is a group of health problems including belly fat, high blood pressure, high blood sugar, and unhealthy cholesterol levels. That together increase your risk of heart disease and diabetes. Did you know the liver is an amazing organ that can actually regenerate itself? If you were to lose up to 75% of your liver today, it could grow back into its full size in just a few weeks. It's the only organ in your body with this incredible ability. This is also why living liver donors are possible. Both the donors and the recipient's liver portions can regrow into complete organs. Isn't that amazing? Now let's move on to signs and symptoms. One of the trickiest things about fatty liver disease is that it often doesn't show any obvious signs in its early stages. However, as the condition progresses, you might start noticing some changes. The most common early warning signs include feeling tired more often than usual and experiencing a dull or achy pain in the right side of your belly, just under your ribs, which is where your liver sits. If the condition advances without treatment, more serious symptoms can develop. You might notice your skin or the whites of your eyes taking on a yellowish tint. That's what we call jaundice. Some people develop spider-like blood vessels just under their skin or notice their palms becoming redder than usual. You might also experience unexplained weight loss, confusion, or swelling in your legs and belly. It's important to remember that these symptoms don't always mean you have fatty liver disease. They could be signs of other conditions too. But If you're experiencing any of these, especially if you have the risk factors like obesity or diabetes, it's worth having a conversation with your healthcare provider. Early detection gives you the best chance of reversing the condition before it causes serious damage. Speaking of detection, let's talk about how is fatty liver disease diagnosed. Your doctor will typically use several methods to confirm if you have fatty liver disease. First, they'll start with blood tests to check your liver enzymes, particularly two important ones called ALT and AST. When these enzymes are higher than normal, it might indicate that your liver is inflamed or damaged. However, it's worth noting that some people with fatty liver disease can also have normal enzyme levels. If your blood test suggests potential liver issues, your doctor might order imaging tests. These include an ultrasound, which usually is the first choice, a fibroscan, which measures how stiff your liver is, and they can also order 4 CT scans or MRIs for more detailed images. In some cases, if there is concern for more serious liver damage, your doctor might recommend a liver biopsy. Your doctor might also calculate something called the FIB4 score, which helps predict how much scarring might be present in your liver. This score is based on your age, platelet count, and enzyme levels. So, if you have been diagnosed with fatty liver disease, you may now be asking, how does having fatty liver disease impact your overall health? Having fatty liver disease can significantly impact your overall health in multiple ways. For example, the condition increases your risk of heart problems, which is the leading cause of death in people with fatty liver. It can progress to a more serious liver condition as well, including inflammation, scarring or fibrosis, and eventually cirrhosis if left untreated. Liver cirrhosis is a serious condition where healthy liver cells is gradually replaced by scar tissue, preventing the liver from functioning properly and potentially leading to liver failure. People with fatty liver often experience fatigue, weakness, and abdominal discomfort. The condition is closely linked to metabolic syndrome, which increases the risk of type 2 diabetes, high blood pressure, and abnormal cholesterol levels. Additionally, fatty liver can affect your body's ability to process nutrients and remove toxins effectively. A word of caution: fatty liver disease can be fatal if it progresses to cirrhosis or liver failure, with studies showing that untreated cases can reduce life expectancy to 3 to 5 years in advanced stages. Although early detection and treatment can significantly improve survival rates, and with the right management, it can be reversible. If you want us to do a video on cirrhosis, let us know in the comment section below. Let's talk about the medical treatments available for fatty liver disease. The approach your healthcare provider takes will depend on whether you have the alcoholic or non-alcoholic type and how advanced your condition is. For non-alcoholic liver disease, there's some exciting news. The FDA has recently approved a medication called resmetirom specifically for this condition. It works by helping your liver process fat more effectively and reduces inflammation. Your doctor might also prescribe medications to address related conditions that could be making your fatty liver worse. These might include drugs to control your blood sugar if you have diabetes, medications to lower your cholesterol and triglycerides, or blood pressure medications where needed. Vitamin supplementation has also shown promising results in clinical studies. We've done a video on the vitamins that can reverse fatty liver disease. The link to that should be on the upper right-hand side of your screens now. We've also added a link to it in the description box below. In more advanced cases, especially if cirrhosis is developed, treatment becomes more intensive. Some patients might need medications to control complications of cirrhosis, and in severe cases, a liver transplant might be necessary. Regular monitoring of liver functions becomes crucial at this stage. Remember though, medical treatment works best when combined with lifestyle changes, which we'll discuss next. Home management and prevention. In addition to medication and medical interventions, you can also manage fatty liver disease at home. Let's start with prevention. The best way to prevent fatty liver disease include maintaining a healthy weight through diet and exercise, limiting or avoiding alcohol consumption, eating a Mediterranean-style diet rich in fruits, vegetables, whole grains, and healthy fats, being physically active for at least 30 minutes most days of the week, and managing related conditions like diabetes, high blood pressure, and high cholesterol. You can also manage fatty liver if you lose weight gradually. Even 3 to 5% body weight reduction can reduce liver fat. It also helps if you exercise regularly, control blood sugar levels, avoid alcohol completely, choose plant-based foods and healthy fats, limit foods high in saturated fats and added sugars, and include omega-3 rich foods like fatty fish in your diet. And speaking of diet, some of the best foods for fatty liver disease include leafy greens and vegetables, whole grains, lean proteins and fish, nuts and seeds, olive oil, garlic, and green tea. In addition to this, we also have a video on the 5 vitamins that can reverse fatty liver disease. It should be linked on the upper right hand side of your screens now. We'll also add that link to the description box. So, is fatty liver disease reversible? The quick answer is yes. Fatty liver disease is often reversible, especially if it's caught in its early stages. Research shows that making the right lifestyle changes and following proper medical advice can significantly improve liver health and even reverse the condition completely. Studies have found that even a modest weight loss of 3 to 5% can reduce liver fat, and losing up to 10% can reverse some of the damage caused by the inflammation. This is particularly true for people with non-alcoholic fatty liver disease. For those with alcoholic fatty liver, stopping alcohol consumption completely can allow the liver to heal itself over time. The liver has an amazing ability to heal itself. It can repair and regenerate, but it needs the right conditions to do so. For a list of vitamins that can help reverse fatty liver disease, check out the video on your screens now. We'd love to hear from you. Do you have a question about fatty liver disease that we did not answer? Let us know in the comment section below. And be sure to check out that video on the vitamins for fatty liver disease. Your Wellness Journal is run by a team of nurses, and we aim to provide you with easy-to-digest information from the perspective of medical professionals who have always been trained to put you first. Please consider subscribing to our channel. We are your Wellness Journal. Have a healthy day.